Welcome! Today, class, you have the wonderful opportunity to sit in on virtual patient education. Our patient, Franny, and her dad, Rigoberto, are with us today, and they are going to learn about their new prescription. Franny has just been started on Digoxin. How are you guys doing today?
So, as you know, you have been started on Digoxin. The trade name is Digoxin. Digoxin is a cardiac glycoside inotropic agent. Some other examples of this drug include amrinone, dobutamine, dopamine, imamrinone, entropin, and milrinone. The therapeutic classification of Digoxin is that it is a cardiovascular agent.
Digoxin has a couple different uses. It is used to treat congestive heart failure, usually in combination with a diuretic and an angiotensin-converting enzyme inhibitor. It is also used to treat heart rhythm problem called atrial fibrillation. Lastly, it can be used to improve the strength and efficiency of the heart or to control the rate and rhythm of the heartbeat, which leads to better blood circulation and reduced swelling of the hands and ankles in patients with heart problems. You will be taking this medication for your atrial fibrillation. Do you have any questions so far?
Digoxin inhibits sodium-potassium ATPase, which increases intracellular sodium concentration, leading to increased intracellular calcium concentration. Autonomic effects of this include vagomimetic action and baroreceptor sensitization, which lead to positive inotropic action, reduced sympathetic response, and decreased renin-angiotensin system output, or neurohormonal deactivation.
Digoxin will decrease your heart rate so that the atrioventricular node, which controls the electricity in your heart, will increase your cardiac output. Cardiac output consists of your heart rate and your stroke volume, so when you increase cardiac output, you increase the amount of blood that is flowing through your body. Digoxin also causes positive inotropic effect, meaning it increases the strength of the muscular contraction of your heart. The ventricular rate of your heart will decrease and your vagal tone in your heart will be enhanced. In other words, the ventricle of your heart will not pump as fast as the vagal tone of your heart will be better.
You are so welcome. Our job as nurses is to make sure you understand everything, and we want to work with you to give you the best care possible. Next, we are going to go over dosing with you.
Usual dosing is based on various factors that include body weight, age, renal function, and other medications taken. You were given a loading dose during your stay here, and now you will get a maintenance dose. Usual doses include 0.125 to 0.25 milligrams IV, or 0.75 to 1.5 milligrams by mouth. You will be getting a by mouth dosage.
Are you pregnant, or is there any risk of you being pregnant?
Okay, great. The pregnancy category of this drug is C, which means either studies in animals have revealed adverse effects on the fetus, teratogenic or embryocidal or other, and there are no controlled studies in women or studies in women and animals are not available. Drugs should be given only if the potential benefit justifies the potential risk to the fetus.
Well, when you take your medication, it is best to take this medicine on an empty stomach. If the medicine upsets your stomach, you may take it with food or milk, and take the medicine at the same time each day. Depending on what is easier for you, take it in the morning or at night. It may be better to take it in the morning, right when you wake up, so you don't have to worry about it for the rest of the day. You can keep it by your bed and just take it right when you get up.
Also, be sure to take your pulse before you take your medication. You can palpate your radial pulse following the line of your thumb. Yes, perfect. If your pulse is below 60 or above 100, contact your doctor before you take the medication.
Perfect. There are some contraindications you will need to be aware of. If you have a hypersensitivity to digoxin or other digitalis preparations, ventricular fibrillation, or renal or liver impairment, you should take caution when taking this medication. You should also contact your doctor before taking the medication if any of those things are a problem.
Now, there are some side effects you will have to be aware of. You may have some nausea and vomiting after taking this medication, and if that happens, you can take the medication with milk or a big glass of water. You may also become dizzy or get a headache or become fatigued. Digoxin may also cause anxiety or depressive symptoms. More serious side effects are cardiac dysrhythmia, ischemia, sinoatrial block, sinus bradycardia, and vasoconstriction. Watch for abnormal heartbeats and paleness of extremities. Look for signs of thrombocytopenia, which is low platelet count, which include easy bruising, red spots on the lower legs, prolonged bleeding from cuts, bleeding from nose or gums, and blood in urine or stools.
We will send home some information with you that will have all of these things we are talking about listed, so you can refer back to it. It looks kind of like this. There are some things that digoxin interacts with that can increase or decrease the effects of the medication. Drugs that increase the effects of digoxin include adrenergic agents like epinephrine, ephedrine sulfate, and isoprel. Antidysrhythmics, which include amiodarone hydrochloride, propafenone hydrochloride, and quinidine. Calcium preparations and calcium channel blockers like diltiazem hydrochloride, felodipine, nifedipine, and verapamil. Drugs that decrease the effects of digoxin include antacids, cholestyramine, cholestyryl hydrochloride, oral laxatives, and aminoglycosides. Herbal remedies, including ginseng, hawthorn, licorice, psyllium, and St. John's wort, will also cause interactions with digoxin.
If digoxin happens to accumulate, or if the serum level of digoxin in the blood becomes too high, you can get digoxin toxicity. Signs and symptoms of digoxin toxicity include anorexia, diarrhea, nausea and vomiting, headache, malaise, blurred vision, greenish halos seen around objects, and confusion. If this happens, stop taking it immediately and call your doctor. The antidote for digoxin is digoxin immune fab, but is only for serious toxicity. Do you have any questions?
There are some nursing considerations that we need to tell you as well. Make sure to report any signs and symptoms of toxicity. Your doctor may want to monitor your serum digoxin levels, which require some blood work. The serum therapeutic level is 0.5 to 2 nanograms per milliliter. You may also need a baseline digoxin level. Make sure to be aware of serum electrolytes when necessary. The doctor will also order blood work for that as well. Renal and liver function are very important when taking any medication. If you notice decreased renal function or liver function, make sure to contact your provider because you may get digoxin toxicity if they aren't working well. Monitor adverse effects, especially for patients who have hypokalemia, hypomagnesemia, hypercalcemia, hypoxia, ischemic heart disease, hypothyroidism, advanced age, small body mass, female gender, and a declining renal function.
Great. Well, if there are no questions from you guys, we will go back to the students. Well, class, thank you for joining us on our patient education of Digoxin. We hope you had a great time and learned just as much as our patients did.
Thank you.